Hello, a very good evening to all of you. Today we are going to discuss the case note of a baby, Brett John Davis. Here we are going to write a letter of referral to Miss Mary Bower, maternal and child health nurse at Albans Community Health Clinic. And this letter is to request her follow-up care for Brett after his discharge back with his family. So it's very simple letter. We are going to write a letter to a community health nurse, maternal and child health nurse in a community health clinic. Okay, thank you. Now, let's go and discuss the case in detail. This Brett Davis was brought to the Children's Hospital by his mother, who was concerned that he had cold. He has had a stuffy nose for the last 2 months. But this was worse. He's to be discharged in the care of his family with a referral to the maternal child health nurse at the local clinic. Now we have the background information here. Brett John Davis was brought to the Children's Hospital. So you are working in the Children's Hospital. And the baby was brought by his mother, and she's worried that the baby has cold. The mother also told that the baby had stuffy nose, which persisted for the last 2 months, which has now become worse. So the complaints are very clear. No, we are not going to write cold, stuffy nose. All these things are layman's language. So when we write the letter, we need to make changes accordingly. So please don't write stuffy nose, cold, or these things as in inverted commas. Many of the candidates just try to copy the case note as it is. But as we are medical professionals, we need to use the formal standard medical terminologies. So we need to change those things into a formal way. I'll tell you later. He's to be discharged in the care of his family with a referral to the maternal child health nurse at the local clinic. So at the local clinic's name is given at the lab. That last word is Albans Clinic. So no confusion. The local clinic. No confusion that maternal child health nurse is working at the local clinic. So it is very clear when we address the name of the maternal child health nurse, and the clinic name should follow as an order. No confusions. Yeah. Now the name is Brett John Davis, date of birth 1993, 2nd February. So address is given, admission date 04 July 1993, and discharge rate is 06 July 1993. So 5 and 6. So 2 days Brett was there in the hospital. Now let us go of the social background. Don't think that the social background is insignificant here, because we are writing something in the discharge plan that is support to Mrs. David in improving parental skills. So why we have written that in the discharge plan, that is support to Mrs. Davis, that is the child's mother, in improving her parental skills. Why is this written? Is because the social background is poor, in the sense, that both of the parents are working, and the mother, she's working in the evening shifts and work till late night. She's working as a waitress, and she is not available at the home till late night. That is something which raises a concern. Another thing is Father Malcolm Davis is a construction worker, works during the day. So it is very clear that morning time father won't be there, and late night till late night his mother will be working, and only a 5-year-old sister will be there. And this is something alarming for an infant, because this child is just 6 months old. So you know that this is something which is alarming. So the social background is very important, and along with the place, what is it's not a big family, so they live in a 2-bedroom flat. Okay, now social background, please don't ignore, because it makes significance in the letter. Now let's go with the diagnosis. We have diabetes media, chronic nasal congestion, upper respiratory tract infection. So um, we don't have any tests or investigations here, but we have got 3 diagnoses here. So we have to write all these things in the letter. So this also becomes significant there. Now, then were developmental screening tests done, which indicated normal developments. As far as this indicated normal development, it doesn't make any significance there in the letter. Most of the candidates who have submitted the letter to me have written this DDST. They're thinking that this is something very crucial in this particular letter. No, it's not. It's not concerned with otitis media. It's not concerned with chronic nasal congestion. It's not concerned with acute respiratory tract infection. It's all dealing with the development, normal growth and development of a child. And as far as we are concerned with the question says that it indicated normal development. We don't have any problems. That if we had problems, we would have thought of discussing that. Now, antibiotics, amoxicillin 50 mg per kg hourly commenced on 12 p.m. on 4 July. So this is something which is the main antibiotics started. We have in the discharge plan, we have the notes here, complete 14-day course. So we started on 4 July. That's the date of admission. It is the date of admission. So we started amoxicillin the same day, and the next 14 days it has to be continued. So 14 plus 10 is 14, and plus 4, 18. Till 18 July, this antibiotic will be going. So that's why we are giving instruction to the maternal and child health nurse regarding this. So we are just giving information that this information that the amoxicillin, that's antibiotic, has to be continued to the full course. That's a 14-day course. Now we have congestion as the next problem. The first problem was infection, that's otitis media. The next problem was congestion, chronic nasal congestion. Now this problem was addressed by nasal and ear toilets. So ear irrigation and nasal irrigation before feeds. So this clears the congestion. So that's why we have given that. So the antibiotics has cleared the acute respiratory tract infection and otitis media. The signs were witnessed after 36 hours. The baby became afebrile, but you know that the congestion restricted his sucking ability. We can still see this congestion is there, but he is seen tolerating free fluids. That's a positive sign too. Now, in the discharge plan, we don't have anything. We have a significant thing, that is support to Mrs. David in improving parental skills. The rest is follow-up care. So that is a very simple letter. So let us look into the letter, a small letter here. This referral letter is being written to request ongoing monitoring and follow-up care for Brett John Davis. The full name is given baby. The baby has been diagnosed with otitis media, chronic nasal congestion, and acute upper respiratory tract infection. So it's a very simple purpose paragraph. We don't have anything complicated there. Um, we have just omitted the day of discharge, so don't think that I have omitted it. We have added towards the last paragraph. Brett was brought to our hospital on 4th of this month with a 2-month history of nasal congestion. We have rephrased it, stuffy nose with nasal congestion, which was reported to have worsened recently. So nasal congestion, when it becomes worsened, you get fever, all these things. That's what we have written. We didn't say cold and all these things there. So please don't write stiffy nose, all these things to a medical professional. We have to use standard language here. So we have used nasal congestion here, which is easy and basic medical terminologies. After diagnosis, the aforementioned conditions, a 14-day course of amoxicillin 50 mg per kg was commenced on the same day at 12 p.m., which has to be continued every hour. A bit complex sentence, but it has a lot of information there. The thing is that the first, after confirming the aforementioned condition, which are the aforementioned condition? Otitis media, chronic nasal congestion, and acute respiratory tract infection. A 14-day course of amoxicillin. So we said directly that it is a 14-day course of antibiotics. When it was commenced on the same day, it's very important, the commencing date and the commencing time, 12 p.m. because it's administered every hourly. So we have instructed here, it has to be continued every hour. It was started at 12 p.m. on 4th of this month. Amoxicillin 50 mg per kg. So the first day, the time, first hour, everything is mentioned there. Now it has to be continued to 14 days. So this is something very clear. A lot of information, but we have to arrange it in proper order. So we have done that. In order to clear congestion, nasal and ear toilets were performed prior to each feed. So that is the second thing that we have done. Apart from the antibiotic, we have started ear toilets and nasal toilets to clear the congestion. Now, the effects of the treatment. Despite diminished sucking ability, the baby was seen tolerating free fluids and has become effervescent. So this is a result of the intervention what we have done. That's it. The paragraph is closed tight. Now about the social history. Baby Brett lives with his parents and 5-year-old elder sister in a 2-bedroom rented apartment. A lot of information again, but it is tight. His mother is a waitress who works till late night, and his father is a construction worker. So that too is written there. So the social history. So when you go with this particular person, Miss Mary Bower, it is she's a maternal and child health nurse. So we have to add that here. Miss Mary Bower, her designation is maternal and child health nurse. Okay, so we need to add the designation to there. So that said, we have gone towards the last paragraph. Brett's parents are instructed to take him to your clinic following his discharge today. So that too is very clearly written there. It would be appreciated if you could continue the ongoing care of the baby along with monitoring the signs of infection. So that's it. We don't have anything ongoing healthcare. That is the antibiotic, nasal and ear toilets, and whatever it is. So whatever is going, you just carry on. And if you have seen any, you monitor or observe any signs of infection or fever or something like that, just monitor it. Also, kindly assist his mother in enhancing her parental skills. So, these are the instructions towards the last. If you have any further queries, please do not hesitate to contact me. Yours sincerely, the nurse. Hope you must have understood this thing. This is not a complex sentence, a complex letter. It's very easy to understand. It's very easy to write, but many of my candidates have written unnecessary things. That is the developmental test. They thought that was important, and they have ignored some of the social background. Some of them, they have written stuffy nose, cold, all these things as it was. So please be careful. Apart from that, most of you can perform this letter. It's quite easy. Thank you, and hope we will be meeting you with another letter soon. Thank you.